Hey guys, welcome back to another video serving as a continuation to the ethics video series. I'm Blake, and today we're exploring the principle of beneficence. This principle simply means to do good. Pretty straightforward. However, there are many layers associated with this concept, and it can concern many relationships that you may have: the public, the work environment, other medical professionals, and then of course the patient. I also think there's commonly some confusion on the difference between non-maleficence, which is do no harm, and beneficence, which means to do good. They do sound pretty similar. The difference is that beneficence is focused on the positive impact you should ethically try to have on the community, workplace, and for the patient like we mentioned. This goes beyond just doing no harm. We want to do good as a dental provider. Now let's begin with a brief overview before we get into the details. The idea of beneficence prioritizes the well-being of the patient, and this concerns three main points. First, your actions and your services must benefit the patient and the public's welfare. Now, it's especially important to note that contracts are not an exception, and this obligation stands regardless of how much you're being paid. Essentially, this means that you cannot provide better care to patients who pay out of pocket versus those on government assistance or other fee-for-service arrangements. Second, the dental provider must provide proficient and punctual care. So, for example, if a patient comes in with several planned treatments, the provider must prioritize based on their knowledge and patient health. In addition, the treatment should be taken care of in a timely manner to not escalate damage. And last, all aspects of the patient should be considered for treatment. Obviously, a patient is not just represented by their oral needs. You must also respect and consider their other needs, desires, and values. For example, an anxious patient may come to your office, and instead of going straight into the procedure, which may be your typical routine, you can offer them breaks, music, or anything to help get them comfortable. This is very high-yield info. Again, if a patient is feeling anxious, give them some time to rest before starting the procedure. Alright, now that we have a general understanding of beneficence, let's try a practice problem. Question 1. A patient presents with generalized gingivitis and heavy plaque buildup. The hygienist knows the patient is very nervous and has limited experience at the dentist. Instead of rushing through the appointment, the RDH breaks the first appointment into 2 visits. Today, there will be x-rays and an exam only. Next time, she focuses only on the cleaning and applies topical anesthetic for comfort and provides detailed oral hygiene instructions tailored to the patient's needs. Which ethical principle is the RDH demonstrating? Option A, autonomy, B, non-maleficence, C, beneficence, or D, justice. Take a second, pause the video, and come back when you're ready to talk about it. And the correct answer here is option C, beneficence. Here, the hygienist is prioritizing the patient's well-being. By booking 2 separate appointments, the hygienist is accommodating for the patient's comfort, which exhibits beneficence. As a hygienist, you should ethically weigh the risks of a procedure. For example, you should consider whether it's ethical to provide care when a patient had a heart attack last week or has uncontrolled blood pressure or diabetes. Many people don't go to the doctor, and informing patients about the risk of doing a prophy with high blood pressure or having a recent heart valve replacement is doing good for the patient. If you need a quick refresher on antibiotic prophylaxis, a good resource is the ADA's guidelines. Here are some additional ways of honoring the principle of beneficence. The first is self-governance, which reminds us that each of us is part of the self-regulating community of dental professionals. So, with this membership, we're responsible for upholding the rules of ethics to continue to present the field and profession in the best manner. The next one is research accessibility. In order to promote public health and advance knowledge in the field, dental providers should make their research results available to all. And last, and this may seem obvious, but professional demeanor is a huge part of beneficence. As a dental provider, you're responsible not only for the way you carry yourself, but also how you promote a positive environment in the workplace. You want to establish an environment of mutual respect, communication, and collaboration. Now, for example, at your dental practice, you may have a colleague that creates a hostile environment by treating other staff in an aggressive manner. As the dental provider, you have an ethical obligation to act and help remediate the situation. In this way, you're honoring the principle of beneficence. The last topic we're going to go over is an incredibly important one, and it deals with abuse and neglect. It is the dental provider's ethical obligation to be acquainted with signs of abuse and neglect and report it to the proper authorities. The dental provider must be knowledgeable and keep up to date with the signs of abuse along with how to report it. Now, one consideration to keep in mind is the idea of an adult's confidentiality and self-determination. If the adult patient chooses not to report the suspected case of neglect, if not required by law, you must respect that decision. With that being said, every jurisdiction has different laws for reporting abuse and neglect, and it's the provider's responsibility to become familiar with their jurisdiction's requirements and act accordingly. Now, it's important to keep in mind that respecting the decision to not report abuse is for adult patients only. If you see child abuse, you need to report it and talk to Child Protective Services immediately. Do not investigate any further, as this is not your job. Once you suspect child abuse, it's mandatory to report this abuse both ethically and legally. As a mandated reporter for child abuse, we want to record any information that we can, such as descriptions of injuries or inconsistencies in parent explanations, and immediately deliver that information to Child Protective Services. But remember, if we see adult abuse, we want to assess first and report the incident only if the patient is okay with us reporting it. Now, a lot of people get confused on why mandatory reporting of abuse would not fall under non-maleficence or the principle of doing no harm. This is because we're not the ones inflicting harm in this scenario. By stepping in and reporting signs of abuse and hopefully preventing future abuse from occurring, we would be doing good, which falls under the ethical principle of beneficence. By now, we've looked at many circumstances where beneficence comes into play, so let's test our knowledge with some practice problems. Question number 2 asks, which of the following is mandatory for a healthcare provider to report? Option A, violation of patient confidentiality, B, patient with opioid addiction, C, suspected child abuse and neglect, or D, patient's refusal of treatment. Go ahead, pause the video, and come back when you're ready to talk about it. And the correct answer for this question is option C, suspected child abuse and neglect. Now, as healthcare providers, we are mandated child abuse reporters, and it's something that falls under the ethical principle of beneficence or do good. So option C is the correct answer to this question. All right, now let's move on to the incorrect answer choices, starting with option A, violation of patient confidentiality. Now, while violating patient confidentiality is a serious issue, it's generally not mandatory to report an incident to public authorities. Instead, these incidents are usually resolved internally and may require the healthcare provider to undergo additional compliance training. But because these incidents are not mandatory reportable events, this option is incorrect. Next, let's discuss option B, patient with an opioid addiction. Now, a patient with an opioid addiction is protected medical information. As a healthcare provider, your job is to support these patients, not report them. Therefore, this option is incorrect. And last, option D, patient's refusal of treatment. Now, a patient who is deemed capable of making medical decisions for themselves has a right to refuse treatment. This right falls under the core ethical principle of patient autonomy. Therefore, this option is incorrect. Next, let's move on to question number 3. Which of the following actions violates the principle of beneficence? Option A, a dental hygienist informs a patient about the risks of uncontrolled hypertension before cleaning. B, allowing an elderly patient to take frequent breaks during treatment. C, treating a decaying tooth before bleaching teeth. Or D, not reporting child abuse. As usual, pause the video and come back when you're ready. And the correct answer to this question is option D, not reporting child abuse. Remember that a main ethical duty of a dental provider is to be able to identify the signs of abuse and neglect and then report it according to the appropriate jurisdiction. Not doing so would be a direct violation of the principle of beneficence. Now let's take a look at the incorrect answer choices, starting with option A, a dental hygienist informs a patient about the risks of uncontrolled hypertension before cleaning. As we discussed, a dental provider should weigh the risks and benefits of procedures and inform patients so they can make an informed decision. This does not violate the principle of beneficence, so option A is incorrect. Next, option B, allowing an elderly patient to take frequent breaks during treatment. This seems like the right thing to do. As dental professionals, we want to accommodate each patient's unique needs, values, and desires. This does not violate the principle of beneficence, so option B is also incorrect. And lastly, option C, treating a decaying tooth before bleaching teeth. The dentist is acting according to the principle of beneficence. Given that bleaching teeth is not as urgent and the decaying tooth is more damaging, the dentist is doing the right thing by delaying the bleaching treatment. So option C is also incorrect. And now for the last question of the video. An elderly man comes in with his daughter and her boyfriend. There are clear bruises on the elderly patient's arm. What do you do? A, ignore it and focus on treating the patient for their dental needs. B, talk to the family and investigate the situation. C, refuse to treat the patient and avoid any involvement. Or D, talk to the elderly man alone and report the incident if needed. Go ahead, pause the video, and come back when you're ready. And the correct answer to this question is option D, talk to the elderly man alone and report the incident if needed. Here we can see that you want to talk to the adult patient, and in doing so, you're attempting to make sure that it is a case of abuse and neglect. If it is, you must also be willing to report it if it is needed. These would be the appropriate actions to take. So option D is the correct answer to this question. All right, now let's run through the incorrect answer choices, starting with option A, ignore it and focus on treating the patient for their dental needs. As dental providers who uphold certain ethical standards, providing treatment is not the only duty you're responsible for. So ignoring a possible case of abuse and neglect is not the right action to take, so option A is incorrect. Next, option B, talk to the family and investigate the situation. Although you may want to help, this is not the most effective or the safest course or action to take. You're responsible for identifying it and reporting it, but it is not within your professional capabilities to go and investigate the situation yourself. Therefore, option B is also incorrect. Next, option C, refuse to treat the patient and avoid any involvement. Again, no ethical dental provider should refuse the treatment solely due to fear of getting involved. Given the circumstances of the problem, there is no immediate danger, and refusing to treat would not be the most ethical way to act. So option C would be incorrect. And finally, that brings us to question 5. Which of the following should be reported by a healthcare provider? Option A, patient's refusal of treatment. B, impaired colleague or healthcare provider. C, colleague who disagrees with office infection control policies. Or D, violation of patient confidentiality. Pause the video and come back when you're ready for a discussion. And the correct answer to this question is option B, impaired colleague or healthcare provider. Recall that under the ethical principle of non-maleficence, you have a responsibility to report any colleague or healthcare provider that's practicing while impaired. This question may have been confusing considering it isn't related to beneficence, but it's important to remember all ethical principles and how they may be asked about in a question stem. We also figured that a little review never hurt anyone. Now let's take a look at the incorrect answer choices. Let's start by taking a look at option A, patient's refusal of treatment. Remember, earlier in the video, we talked about patients having a right to refuse treatment and that right falling under the ethical principle of patient autonomy. Therefore, option A is incorrect. Next, let's take a look at option C, colleague who disagrees with office infection control policies. Now, colleagues can disagree as long as they continue to follow the established infection control standards. Reporting would only be required if the infection control standards were not being followed, ultimately putting patients at risk. So option C is incorrect. And last, we have option D, violation of patient confidentiality. We've also talked about this answer choice previously in this video. Remember that violation of patient confidentiality is typically addressed on an internal level and is not mandatory to report. Therefore, option D is also incorrect. All right, everyone, that's going to wrap up the practice problems for today. So let's finish the video with a little summary of everything that we've learned. Under the ethical principle of beneficence, we need to prioritize the well-being of the patient. It's also important to improve community dental health and welfare of the people. And whenever we identify signs of abuse, we should be reporting it. All right, guys, that's it for today's topic. Thanks for watching, and I can't wait to see you in the next video.